hand over mouth technique is also known as home. So it is an aversive behavior modification technique used to modify negative child behavior during his or her visit to a dental clinic. And it is first described by Dr. Evangeline Jordan in 1920. So the important point here is, first one is it is an aversive behavior modification technique, and the second point is first described by Evangeline Jordan. And other names of this home is, first one is aversion, given by Kramer in 1973, an emotional surprise therapy given by Lamshire, and hand over mouth airway is restricted, that is HOMAR, given by Levitas, and aversive conditioning given by Lensher and Wright in 1975. These are the other names for home technique. Next, moving on to objective of this condition. So first we have to gain the attention of the child and enable communication with the dentist, and increase child confidence, remove inappropriate behavior to dental treatment, and deliver quality dental care to the child safely. So these are the goals of this technique. So we have to gain the attention and increase the child confidence, and we have to give the good quality dental care to the child. And what are the indication and contraindication? First indication is the child who is able to cooperate but exhibit unwanted behavior to dental treatment. So here the child is normal but they produce some unwanted behavior to the dental treatment. So this type of child we have to use this technique. And 3 to 6 years of age, use this technique. And contraindication, child under 3 years of age, and technique prevents child from breathing. So if patient having some breathing difficulty, definitely we shouldn't use this technique. And the child and dentist are emotionally involved, and child is an immature child. That is immature child, that is under 3 years of age. We don't use this technique. And what is hand over mouth technique? The dentist places his or her hand over the child mouth and explain the kind of behavior which is expected from the child. So we have to place the hand on the child mouth, and we have to explain the child what we want from the child. So the child is informed that the hand would be removed only after required behavior begins. So as the child responds, the hand is removed. So this picture shows the home technique. So we use the hand and place the hand over the child mouth, and we expect some behavior. Once the child is response, we have to remove the hand. So legal use of home technique is, definitely parents' consent is must, and HOMAR, that is hand over mouth airway restricted, should not be used by dentist. So we have to place the hand only over the mouth. And what is the variations? And hand over mouth and nose. So hand over mouth and nose also is present, and towel over mouth, dry towel over mouth and nose, and wet towel over the mouth and nose. These are the variations of technique. So let's see some MCQs. First question is, hand over mouth exercise is effective behavioral modification technique in the age group of option A 3 to 6 years, option B under 3 years, option C 6 to 9 years, option D above 9 years. So the answer is 3 to 6 years. So home is the effective technique only in 3 to 6 years. Under 3 years we shouldn't use this technique. And second question is, home technique is used to option A verbally intercept unruly child behavior, option B calm a disabled child, option C scare the child into submission, option D intercept tantrums of an otherwise normal child. So here the answer is, home technique is used in option D, intercept tantrums of an otherwise normal child. So question number 3 is, home technique was first described by option A Dr. Evangeline Jordan, option B Adelson and Goldfried, Option C, Dr. Goldman. Option D, Dr. G.V. Block. Option D, that is G.V. Black. So here the answer is home technique was first described by Dr. Evangeline Jordan. So option A is correct. So the fourth question is, home technique should not be applied to. Option A, 5 years old child. Option B, who exhibit historical behavioral during treatment but mentally sound. Option C, child who can understand simple verbal command but exhibiting inconsolable behavior. Option D, immature frightened child. So here the answer is option D, immature frightened child. The home technique should not be applied to this type of patient. And fifth question is, home is option A, aversive technique. Option B, remodeling. Option C, psychological improvement. Option D, none. So here the answer is home is, it is a aversive technique. So option A is correct.